Hi, in the previous video we discussed hospitals' propensity to balance bill when a patient has a commercial policy and a Medicare Advantage policy. In this video we will address a more bizarre scenario. Just to review, we know that Medicare is the secondary payer when an individual has a commercial policy as well as Medicare. Medicare secondary payer is the term generally used when the Medicare program does not have primary payment responsibility. That is, when another entity has the responsibility for paying before Medicare pays. If the commercial policy does not pay in full for the services, Medicare may make a secondary payment for Medicare-covered services up to the Medicare-approved amount. If a commercial policy denies payment for services because those services are not covered by the plan, Medicare may pay for these services if the services are covered by Medicare. Providers in healthcare institutions, having agreed to accept assignment when contracting with Medicare, have also agreed to accept Medicare allowable charges for services and procedures. Medicare does not allow balance billing. Balance billing is billing a patient for the difference between the allowable charge and the provider's usual fee schedule. The following example will highlight the lack of understanding that exists in hospital billing departments when dealing with individuals who have both a commercial policy and a Medicare Advantage policy. In this example, the patient has an Aetna Medicare Advantage policy and again, an independent BlueCross policy. The patient's physician orders an MRI of the pelvis for medically necessary reasons, cancer of the prostate. The Aetna Medicare Advantage policy authorizes the MRI. Independence Blue Cross denies the medically necessary MRI. The patient appeals Blue Cross's denial, but it is again denied without sufficient explanation of why. The hospital doing the MRI reports to the patient that after checking with Aetna, the patient is responsible for a coinsurance of 25%, which will result in the patient being required to pay $680 of the $2,720 charge for the MRI. The patient tried to explain to the hospital that his Medicare Advantage program would not have a coinsurance, but would have a copay of 25% of the Medicare allowable charge of $430 for the MRI, which would result in the patient being responsible for $107.50. It was apparent that the hospital had not checked with Aetna initially, as they had stated. An actual conversation between Aetna and the hospital's cost navigator was necessary in order to assure that the hospital would bill the patient correctly. The MRI was scheduled, but the day before the MRI was to be done, the hospital billing department called the patient to inform him that he would not be allowed to have the MRI. That's the actual quote. Would not be allowed to have the MRI. The hospital billing agent informed the patient that she had talked to Independence Blue Cross and was told that since Independence Blue Cross had not authorized the MRI, the patient was not allowed to have the MRI. You might think I jest, but this is what was articulated by the hospital billing agent to the patient. The hospital billing agent would not listen to any reasonable arguments presented by the patient, telling the hospital billing agent that she and Independence Blue Cross were wrong. The patient called Independence Blue Cross just to check on what was actually articulated. An agent from Independence Blue Cross confirmed what the hospital billing agent said. She, the Independence Blue Cross agent, informed the patient that if Independence Blue Cross denied the MRI, no other insurer was allowed to authorize it. That's the actual quote. No other insurer was allowed to authorize it. Yes, that is what the patient was told. The patient asked the agent to repeat that to him. She did repeat the same thing. Of course, she was wrong. The hospital was obligated to accept the Medicare allowable rate for the MRI. Independence Blue Cross has no right to refuse to authorize a service and then say that another payer, in this case Medicare Advantage, could not authorize the service. The MRI had to be canceled. I bring this to your attention to highlight the gross incompetency. You do not want to see your patients treated in such a manner. This type of incompetency harms your patients and subjects your organizations to considerable liability. Well, I hope this helps. Have a good day.